My name is Dr. Asheesh Gupta. I'm an orthopedic surgeon and I am one of the partners at Ortho Laser Woodbridge. And I'm excited to discuss today pre-op laser therapy and why I think that's important. So traditionally here at Ortho Laser, we do treat acute, chronic, and post-op pain. However, as we've been seeing the results of laser therapy and how it affects the tissues, we've started implementing a pre-op package for our surgical patients. And there's a few reasons why we think this is very important. So number one, what is the rationale of pre-op laser therapy? We think that the laser therapy can help decrease any inflammation of the tissues and in and around the joints prior to surgery. That can help aid the surgeon during the surgery, but also primes the tissues and allows them to be as responsive to healing postoperatively as they can be. So traditionally, we would recommend 6 sessions of laser therapy, and that would be in the preceding 2 to 3 weeks prior to surgery. And then that would follow up with 6 to 12 sessions of laser therapy after surgery to continue with the anti-inflammatory cascade, as well as improve the healing of the soft tissues and of the incision as well. So what are the benefits of pre-op laser therapy? The first and the most obvious is reduced generalized inflammation of the soft tissues. So you have a much calmer, less irritated surgical area. The second thing is improved circulation, so more oxygenation to the tissues, which also aids in healing. The third is a faster healing response postoperatively. The fourth is less post-op pain, so less need for opioids postoperatively. And when a patient has less inflammation around the joints, that oftentimes does lead to improved joint range of motion, which helps the patient postoperatively, for example, after a post-op total knee arthroplasty. And this in general leads to less complication rates because we have healthier tissues, and this can lead to less scar buildup and the potential for less post-operative complications.